Like you have a car and you have to service that car, maybe every year. What's the reason why you are servicing this car? You are servicing the car because you want to make sure that it doesn't break down on the road. You want to make sure that you are getting value out of it. Yeah, that can actually be likened to our health. When we believe that we can make positive changes in our health, we are more likely to engage in these preventive actions. A lot of diseases are actually preventable. Remember when my dad was sick in the hospital, like we spent easily almost or up to, if not more than 15 million easily. The more we practice preventive health, the lower the prevalence of or the commonness of a disease. Hello guys, welcome to my channel, or welcome back to my channel. Today we're going to be focusing on preventive health, and like I mentioned in my last video, I already introduced myself if you watched my last video, but if you didn't watch my last video, I'll put the link in the description box below. You can go back and watch that video just to have an idea of who I am and why I'm doing this. Anyway, let's move on. So if you're joining us for the first time today, please make sure you hit the subscribe button below. And if you're a returning subscriber, thank you for coming back to watch this video. So like I said, today we're going to be focusing on preventive health. And guess what, guys, I'm really excited about this one because this is going to be a series, because preventive health is something that we can't talk about just in the next 30 minutes or in the next 1 hour. Preventive health is really it's a broad topic. It's really a broad topic, and we can't really talk about all of that in one video. So this is going to be a series. So we're going to take this as episode 1 of this series, preventive health series. And today's episode is going to be focusing on the reason why preventive health is important. Okay, we're going to be focusing on why are we talking about preventive health? What's the importance of it? Do you understand? So we're gonna take a break and then we'll be right back. Why am I doing this series? What's motivating me to do this series? Like I said in my last video, I didn't have any interest in really doing nursing. Bedside nursing is not my thing. I don't like it. But preventive health is more of what I think what I like. Like health education and things like that. I think that's more of what I like, which is the reason why I said I after my NYSC, I went back to do masters in public health. And I think I felt at the time that doing masters in public health would give me the opportunity to move from the nursing field, basically. Another reason why I'm doing this is because of my personal experience as well. I recently lost my dad, and he died from cancer. So he had prostate cancer about a year before he was then diagnosed with pancreatic cancer, which was what eventually killed him. So I feel like from this experience, apart from the emotional and financial burden that comes with that, I just feel like a lot of people don't really like preventive health. Is probably not really talked about as much. So I just want to use this medium to talk about it, create awareness for it, because to be honest, a lot of chronic diseases can actually be prevented if we actually do the right things. This can be prevented. So, what exactly is this preventive health that I'm talking about? So, preventive health is just all about, staying proactive, maintaining your well being so that you can detect and tackle health issues head on or early enough. Preventive health is actually like our first line of defense against illnesses. And there are so many elements to preventive health. That's why I said we can't do it all today in one video. So many elements of preventive health. We have regular checkups, healthy eating a balanced diet, managing stress, our mental health, being aware of our mental health, going for vaccinations, going for screenings, using safety measures in everything we do, hydrating ourselves, sleep hygiene. All of these things are actually what makes up preventive health. Like I said, we can't talk about all that today. So today we're just going to be talking about the why, and subsequently we'll talk more in depth on all of these elements, individually. So why is preventive health important? Preventive health is actually important for like early detection of diseases. And how do we detect diseases early? By regular checkups, screening tests. All of these can actually detect health issues in their early stages. This actually makes it easy for the treatment plan to be more effective. For example, early detection through screenings like mammograms, or colonoscopies or cervical screening tests will significantly increase the chances of successful treatment. Because imagine someone does a test and they find like stage 1 cancer. Yeah, at that point treatment is still going to be really effective. You're going to be saving costs as well, which is another reason why preventive health is important. So we're saving costs if you are going for regular checkups, if you are doing your regular screenings either yearly or every 2 years or every 5 years, whatever it is. You're saving costs, and it is actually more effective to incorporate like lifestyle changes now. It is more effective to do the right things now. It is more effective to go for your regular screenings now. It is more effective to make sure your vaccinations are up to date now than for you to, get sick in the future, having to spend, a lot of money. Remember when my dad was sick in the hospital, like we spent easily almost or up to, if not more than 15 million easily. So, all these things can actually be avoided. Another reason why preventive health is important is because it actually improves our quality of life. Applying preventive health measures can actually increase your quality of life. And why is that? Just really simple. It's just because things that may impede a healthier and happier life in the future can actually be dealt with now. Yes, so things that can cause illnesses in future, that can stop you from having a healthy life or stop you from having a happier life, quality life, can be dealt with earlier on. For example, eating a balanced diet today or doing regular exercises, having a good sleep routine, all of these things actually will improve your quality of life. It will also improve your output. It will improve your immunity as well, which will ensure that your body is fighting off against illnesses. So another reason why preventive health is important is because it reduces mortality rates, and that's death rates. A lot of diseases are actually, like I said earlier, a lot of diseases are actually preventable or manageable, which means that preventive health can actually reduce premature death. Let me give you an example or an analogy. Like you have a car, and you have to service that car, maybe every year. What's the reason why you are servicing this car? You are servicing the car because you want to make sure that it doesn't break down on the road. You want to make sure that you are getting value out of it. Yeah, that can actually be likened to our health. In order for us to live a quality life, you don't want your body to break down. You have to service your body, And how do you service your body? By going for your regular checkup, by doing the right screening tests, by making sure that you are drinking a lot of water, by making sure that you have a good sleep hygiene, by making sure you eat a balanced diet. So all of these things will actually servicing your body so that it doesn't break down. And that's the whole point of, all of this. Another reason why it's important to talk about preventive health, or why preventive health is important, is because it actually reduces the strain on the healthcare system. The more we practice preventive health, the lower the prevalence or the commonness of a disease. It will allow people who actually need to be in a hospital or to access healthcare, it will allow better access for those people. So it's not just for us, eventually it's for the society or the community at large. I feel like preventive health also empowers us. It improves our self-confidence. It empowers you to take control of your health, of your well-being. It builds your self-confidence. When we believe that we can make positive changes in our health, we are more likely to engage in these preventive actions like exercising, maintaining a healthy diet, quitting harmful practices like smoking, excessive drinking, and things like that. Just to recap, preventive health is your first line of defense against diseases. It involves making smart choices. It involves adopting habits that can help you lower your risks of developing chronic diseases. Next week we'll be talking about sleep hygiene, which is another element of preventive health. So like I said earlier, we'll just be taking these elements one after the other so we can actually go in depth, so we're not just brushing over it. Next week I'm going to talk about sleep hygiene, give you practical tips on what you can do to make sure you have a good sleep hygiene, and then we'll go from there. Okay. Thank you so much for watching, guys. I hope you learned something from this. And I hope whatever you've learned, you put it into action. Remember to share this video with your family and friends. I'm sure there's nobody that would not benefit from this video. So send it to your friends, to your family, to your enemies as well. Thank you very much, guys, for watching. I hope you have a great week. Remember, your body, your responsibility. Take good care of it. Okay? Bye-bye. See you next week.